Afternoon, everyone. I'd like to call to order the meeting of the Commissioners' Finance review here that we hold each week, each Wednesday. Today, April 14, the hour is 1:30, so we are ready to commence. And so with the meeting in order now, I would note we have second on our agenda item. On our agenda is the approval of the minutes from our April 7 meeting. Minutes are in hand. Anyone wish to
I'll
propose?
move to approve those minutes.
Second.
Okay, it is moved and seconded. All in favor indicate by saying aye.
Aye.
Okay, motion carries. Okay, that moves us right into our main topic of discussion for today, which is the fiscal budgets of 2021, 2022. So our Chief Finance Officer is here, Dana Best, and she's going to lead the charge here and giving us the overview. We have a number of the fiscal departments who are available to us to provide some perspective and answer questions. So at this point, I'll hand it over to you, Dana.
So I'll start by saying I'm pinch hitting for Tammy today, because Tammy normally runs these, but she had a family emergency, so she'll be back on Friday. Just to give an overview of some of the dates that are coming up. You've already been provided a draft of the budgets, but you'll more formally receive one on April 20th is the goal to have the finished version. The copy that you have doesn't have the fund balance on it. It's coming out of the budget, the new budget, and it's not completely built, so they're hoping that they get that piece in. If not, we will still be presenting it. The only piece we'll be missing is the fund balance. That's slated to be done with the calendar budget. So the budget will be placed on view on May 3rd. It'll be on the workshop of the 29th, and then placed on view on the 3rd. The FAC budget presentation is slated for May 26th, and the ultimate approval of the budget would be June 1st.
Okay, thank you.
So we started at this a few years ago where we have the Human Service Roundtable, where they can just basically give you information that they think is important for you to have about the next budget, not necessarily the numbers, but more programmatically. So we can all see Nikki, so we'll start with Nikki and Lisa, whichever they use.
Good afternoon, everybody. I'm going to go ahead and let Lisa start. She's got a bigger portion, and then I'll fill it in.
Might be bigger, but it's a little bit easier probably. So, Silver News received our certified allocation about 2 weeks ago for fiscal year 21-22. Once again, I think we did very well. We asked for $25,769,868, and we got $25,686,891. We did receive 82,977. I think that's the lowest number that I can remember of not receiving, and actually of that 60,000 they moved out into a grant. So basically we did very well. We're just short 0.32% of our total request. So we got everything we asked for basically. I do not believe we will be in overmatch this fiscal year that we're in, 2021. We actually are about just under 1% less of where we were in the prior fiscal year in 2020, and we were not in overmatch that year. So I believe we are in really good shape. So that's all I have.
Thanks, Lisa. I can just add in to let you know that in 21-22, we asked for 3 positions, and we did get approved for all 3. It was 2 paralegals and an admin assistant. We still have several positions on the books from the previous years. So sorry, there's trains going by right as I'm talking. But we still do have positions from the previous year that have not come before the board to be created yet. We only added 2 new positions this past fiscal year. Our numbers are pretty much staying the same. I did a little bit of comparison. Obviously, like everybody else, right in when the COVID hit, we did drop for about 2 months, but our numbers are back to exactly where they are from the previous years. And for placement numbers, we are still seeing that we are doing very well with the children that are in placement. almost 75% are in either a kinship foster home or traditional foster home. Utilizing the least restrictive environments for the kids, which is really good. And we definitely are seeing an increase in kinship numbers. That's all we have for children and youth.
All right, thank you. Sandy, you wanna go next? Sandy.
Annie Hoffers.
Oh, Annie,
Yeah.
Annie, and Christine.
Hi.
Aye.
So I'm filling in for Sandy this week, she's off. So CARES Act funds were the focus of last year's budget, and CARES Act and American Rescue Act funds will continue to impact the aging budget for 21-22. We're supposed to receive American Rescue Plan money from the Department of Aging with more details on that coming soon. March 2020 through February 2021, we served 10,500 more meals than the same period of the previous year, using CARES Act funds. The largest increase was in home delivered meals to accommodate older adults who couldn't make it to senior centers because they didn't have transportation. This will continue as long as we're in public health emergency. CARES Act funding also enabled us to end the waiting list. That was started in July 2019. 65 people were taken off the list, although there's still about 40 people waiting for services due to there not being available providers. Lack of direct care workers continues to be an issue. It was an issue pre-pandemic, but it's been worsened as a result. We are working with the Department of Aging to try to address that. It's important to note, I'm sorry, can I say something? Important to note that the elimination of the waiting list was only possible due to the addition of CARES Act funding, but it isn't sustainable. Per PDA guidance, we were made aware that services could be terminated with the end of emergency funds. But with more funds on the horizon for 21-22, this shouldn't be an issue yet. An updated intrastate federal funding formula will be implemented in the new fiscal year. Department of Aging was directed to update the formula because it hadn't been done since 2012. Census data pertaining to the factors in the Older Americans Act was used to determine new allocations. And as a result of that, Cumberland County will see an increase in some of our federal funds that cover Older American Act services due to an increase in pension. There's no anticipated increase in the upcoming state budget for the Human Services Development Fund or the Homeless Assistance Program from the Human Services Block Grant. But the full impact of the Emergency Rental Assistance Program is yet to be. The funds are being managed by Cumberland County Housing Authority. It's safe to assume that it'll reduce the need for regular rental assistance program in the coming year because those people will qualify for the less restricted emergency assistance. And those who are homeless or near homeless will be able to receive rental assistance, so if they won't find housing. And the food program allocation is also anticipated to be the same.
Any questions for? Jack?
Thank you.
Ryan? Thank you. Jack and Ryan.
You say Jack and I?
And Ryan, if he's here, sorry.
Yes.
Yes. Good afternoon, Commissioners. Like the rest of the world, the challenge for our department over the past year has been the COVID-19 pandemic. After a little bit of a learning curve, our staff did a very good job in learning how to convert our services to telehealth, teleeducation, teletraining, and so we were pleased with that transition. Our provider network also did a very good job. In particular, our outpatient, intensive outpatient, ambulatory services quickly adapted to being able to provide counseling services via teleconferencing or via the phone to allow services to continue. They also did continue to offer in-person services, but the demand for in-person services understandably dropped quite a bit. It's begun to pick up again though, as vaccinations have become more widespread and our metrics are generally trending in a positive direction. There are more in-person services occurring. I think the challenge for our inpatient providers, detox, hospital rehab, halfway houses, have been even greater. Almost all of our providers have at some point or another had a COVID-19 outbreak and had to isolate, quarantine for a couple of weeks, and cease new admissions. So that's been challenging. The most significant impact, though, is that we have seen the progress that we made in reducing overdose fatalities in Cumberland County and in Perry County. The progress we made in 2018, 2019 was lost in 2020, and increases overdose deaths increased in 2020. And so that's a major concern of ours. Financially or fiscally, we actually did quite well over the past year. And that was due to a variety of factors. One, because of mitigation, the actual demand and utilization of services was down. A second factor is that with our Health Choices Medical Assistance Program, during the pandemic, the state has put in place a policy that nobody is being terminated for medical assistance. And so normally, there would be a number of folks who would only have medical assistance on a short-term basis, then they would be dropped. And many of those individuals would end up relying on our limited county funding, county managed funding to pay for their treatment services. But because they're not being disenrolled from MA, it actually contributed to a reduced demand for our services. And then the other factor is that I think you all know that over the past several years, we've been mandated by the state to expand drug and alcohol treatment services, particularly medication-assisted treatment services that are indicated for people with opioid use disorders. And we've been able to do that with an influx of federal funding. We've actually had a deliberate strategy of building up our fund balance again in anticipation of that additional federal funding pending. It was only committed for a couple of years. Well, during the past fiscal year, we did receive confirmation that the federal funding has been expanded for 2 additional years. So that also contributed to a good year financially for us. And we were actually able to slightly increase our fund balance. That's still important to us because at some point the federal funding is going to end. The moratorium on disenrolling medical assistance recipients is going to end, and the demand on our treatment services will increase. So we're pleased to have a fund balance available to help accommodate that transition when it occurs. The other factor that I'll mention is we're grateful for the CARES funding. That allowed us to acquire some laptops and be more capable in providing mobile services. But at the same time, it also relieved us from a year of the normal life cycle cost of replacing computers. So that was another saving. Looking forward, the state budget for drug and alcohol projects flat funding, and so that's good news for us. That means there's no cut in funding for the upcoming year in state funding. But we're also told that as I already mentioned, the federal funding is projected to continue for another 2 years. So we know that our county subsidy or county match will remain the same for the next fiscal year. there any questions, comments?
So, I wanna add one thing, he talked about not having to do the life cycle replacement. It wasn't, we did not use CARES funding for that, they reallocated their computers to other people. So if they replaced with a laptop, they replaced.
Right. He had folks who, got a laptop and replaced their desktop, but the desktop still had, 3 years of good life on it. So those of us who were due to have our desktop replaced after 6 years, were able to have it replaced with one of these, repurposed desktops. So it was kind of a trickle down.
Yes. I just wanted to make that clear because the life cycle replacement is not eligible under CARES, so.
Thank you, Dana.
You're welcome.
Dana, if you could just hang on for a second. Stacy, is all of that glitchiness also happening on your laptop?
Not all of it, some of it is, some of it isn't, I've reported it.
Okay, because it's really.
It's
I mean,
distracting.
It's, well, and we just bought all this new equipment, it should be working properly. The other thing is that the sound is terrible today. There's like a muffle. I mean, I could clearly hear Jack, I understood every word he said, but there's a terrible muffle. Like, we just bought all this stuff, it should be working. And Dana, as we switch to a new group, I think, and this is, since this is a public meeting and there might be people watching, like, I know who Jack is, but it doesn't
Same
mean everyone
names.
else does. So I think it would be good to introduce, what department people are with.
Okay,
Thanks.
I'll use your last name too. Are you ready? Did you need to do something else with the?
I mean, I think we should proceed, but that should not be happening. It should not be happening at all.
Sue Carball, IDD. Sue Carball is the director of IDD.
IDDB.
Individuals with
Yeah.
developmental disabilities. Is that
Intellectual
right, Sue?
intellectual disabilities.
Okay.
That is correct.
We just have to be careful of the acronyms this year.
Yeah, so it's intellectual disabilities, and EI stands for early intervention. So, in intellectual disabilities this past year, during the pandemic, we've had to operate remotely. Our case management has been doing a bang-up job with it. They have had excellent productivity, with checking in on our clients. Our day programs and our health provider programs have basically had to close up for a good part of the year. They have tried at different times throughout the year to open back up, and we follow the percentage of positivity, and depending on what those rates are, they can either remain open or they have to close again. So if our positivity rates go over 10%, our programs have to close. Some of them have been able to do some work with clients remotely, but for the most part, the programs have remained closed. Throughout the better part of the year. We have seen them start to reopen again. Perry County is not closed down again because they're open, or their positivity rate is over 10%. We have, most of the programs in Cumberland open, but they are open at reduced capacity. And for that reason, we have funding left in the ID budget because of the programs that have been closed or only at partial capacity this year. Our referrals for service have remained steady though. We have opened a number of cases up this year. As you are aware, in the intellectual disability system, we have a huge waiting list for service. Across the state, that number is over 12,000. In Cumberland County, our waiting list is at 300 approximately, with about 100 of those in the emergency category, meaning they need service as soon as we can get it. A lot of those folks are graduates who are on that list. There are some folks that are waiting for rehabilitation services,
transportation is another service that drives our emergency list up. So, in this year's budget, proposed budget at the state level, there is another waiting list initiative for intellectual disabilities. And if that budget gets approved, we will get additional waivers to help us with our emergency wait list here in Cumberland Perry. As far as early intervention goes, they have done their case management primarily this year remotely. All the therapy services for the children, speech therapy, occupational, physical therapy, have almost all been done remotely. And then we had a good number of families saying that they wanted the therapist to come in person and work with their children. So we started to do that, based on family decision, and then, the provider's decision, if they were able to follow the masking and the social distancing and all those, other, needs because of the pandemic. So right now, we are doing a lot of early intervention services face-to-face, because of the families are saying that that's the way they want it. The referrals in early intervention, like intellectual disabilities, have stayed steady throughout the year. There is a proposed budget for next year for early intervention that includes an increase. It's something that early intervention needs, and we consistently needed that in our budget here at Cumberland Perry. I think this year, and I'm looking at Linda to say, okay, I think we are right now breaking even, basically, or are we in the hole a little bit?
We're actually pretty close to breaking even in early intervention. We have a little bit of excess right at this point, but that is because services have not been done to the full extent that they could have been done this year.
So what usually happens in early intervention if we do have a deficit is that the state, through a number of rebudgets that we are asked to do, basically have always come through and made us whole. So if we would need money this year, in fact, we just got the notice for the first rebudget for this year. So that's where we're at right now with intellectual disabilities and early intervention, excuse me. Does anybody have any questions? Linda, is there anything you want to add?
No, the only thing I would ask, and I know Gary's heard me harp on this so many times, the state instituted a random moment time study this year, but in order to get our federal funding, we have to report quarterly to them, and then they take surveys throughout the whole state, and they apply a percentage to that, and then that determines how much federal funding we are getting. And for every federal dollar that we get, we have to have either a state dollar or a county dollar to match that funding. So it's definitely been a roller coaster ride for me this year, trying to figure out, are we still getting the same amount of money? Are we getting less money? Do we need more county match, or how it's going to all work out? But so far, I'm confidently gonna say I'm gonna be able to stay under what we've been asked for, what we have in our subsidy budget for this fiscal year, and hopefully for next fiscal year also.
Any additional questions? Okay, so now we'll turn it over to Andy Straight, the mental health director, and Linda.
Good afternoon, Commissioners. Well, I like Linda's term, roller coaster ride. I feel specifically around the mental health office, this has definitely been an interesting year for sure. We received our initial allocation for the current fiscal year. I just looked it up, December the 17th. So we were literally 6 months into the fiscal year before we knew how much resource we had to work with. Typically, the state maintains flat funding. So, but given the pandemic and given what we continue to hear about, tax funds not being submitted to the state, we had a real concern that our budget would be cut. So trying to manage that on the front side rather than worrying about it on the back side was a focal point, early in this fiscal year. So to manage that, we chose to only contract specifically for social rehab services for adults with serious mental illness for 6 months. Because we knew that all of those providers were only providing tele-intervention, they weren't seeing people face to face. So we only did a 6-month contract. Well, that helped us, basically to manage that a little more efficiently. Then in December, when we did receive our allocation and recognized that we continued to receive the same allocation as we did the year prior, that was helpful to us because then we could, manage the fiscal resources hopefully a little more efficiently. We did have a couple of staff who were laid off as a function of not being able to see people face to face. We didn't need the same level of staffing in that particular cost center of our budget. I will say that probably out of all of our service providers, the ones that have stuck out to me is doing phenomenal work. Crisis intervention, right through the pandemic, even though, the community as a whole, let's face it, this has been stressful for all of us and anxiety producing for all of us. So our crisis program has been overwhelmed with many referrals, lots of interventions. So that's been kind of a challenge for us. Different pockets of the community too isn't the people that we know that come and participants in our service. It's been other pockets of our community who have been impacted. So right through the pandemic, crisis intervention has been very engaged and seeing people face to face, working, providing many more low outreach this year than in years prior, many more ride-alongs with the police than in prior years. So hats off to that provider and that agency. Similarly, our residential providers have done phenomenal work. Because with the pandemic and isolation and social distancing, they're literally working in programs with people with serious mental illness, and they're not able to do the things that typically people would be engaged in. So they have done phenomenal work trying to help people stay calm, stay focused, and stay engaged in their own personal wellness. So I've been really pleased with just what an excellent job they've done. Other areas, things that even though with the pandemic and that has in some ways slowed things, we've also had opportunity to increase the services that we are. You've heard me talk many times now about the long-term structured residence that we created through the ACLU lawsuit settlement. That program was licensed in late September. So we've been really pleased with the inclusion of that program into our array of services that we're able to offer. That was a pretty significant undertaking. It was about a $2.3 million project. And then this year we've also started our CAS program, our elementary student program, developed what's called an ESAP, Elementary Student Assistance Program, is a preventative strategy working in elementary schools. So utilizing our staff differently and engaging school professionals. So our staff serve as liaisons, so they're all actively engaged in the districts and trying to help families earlier. Of course, this year, truancy has been a significant issue. So, and with schools being operated remotely, that gave us another barrier to try to navigate. And we've sort of operated with, trying to manage that with the districts and with the school personnel to the best of our ability. Along with that as well, similar to what Jack was talking about, we've seen an increase in suicides. And you're probably well aware of the trainings that we've been doing through the county as well as through the community. We've been doing QPR, question, persuade, refer, suicide prevention trainings with law enforcement agencies. Last year, we saw a decrease in suicide. Here, in the first 3 months of this year, we've already seen a 30% increase in suicides in Cumberland County alone. So we're really monitoring that, really trying to continue to support people as well as we're able to, trying to think of ways to intervene sooner, to try to offer the best support we're able to. Definitely a difficult and challenging year. We're also this year attempting to implement a co-responder program. We've been having conversations with the Partnership for Better Health, or our 911 communications staff, provided us with data around the number of psychiatric related calls coming into the 911 communication center. So we've developed a work group to try to make some plans on having police be able to intervene with a social worker, crisis worker. So we're trying to implement that this year. So we're excited about that opportunity. We're looking at hopefully being able to use some community mental health services block grant funds. Just this past Friday, we participated in a meeting with the state regarding what is the next stimulus package, and the funds will be released based on a letter of interest and an opportunity to write a proposal. And it looks like this will begin during the beginning of the year 21-22, which aligns well with the projects that I was describing with the co-responders. So I'm sure that we'll be having further conversations about that. I also just wanted to comment, similar to Jack's experience with drug and alcohol, because of health choices and the Medicaid enrollment and people not leaving the medical assistance rosters, that has had a similar impact on our budget, where we have not used as much of our county-based funds to provide treatment services for individuals because there were more individuals who were on Medicaid rosters, which is a cost shift, but it has saved us funds so we could reallocate it differently and do different work in the community as a function of that. I think the other thing I just wanted to make sure that I was communicating about is we are working on this year doing some crisis intervention training with local law enforcement. We're excited about that as well. Our first trainings will be in May. Trainings like this are excellent, and yet they do come with a cost because of the time and the resources that it takes to pull it all together. So we're excited about it, though. We have staff who are planning to do these kinds of trainings 2 times a year until we have all law enforcement agencies trained that want to participate. Do you folks have any questions for me?
All right, I believe that's everybody.
Thank you.
So,
That's everyone.
it's all the human services, we don't usually bring call in and it's more for the human services. Normally, it takes an hour and a half.
Okay.
Taking it up and through all this, I didn't see any real red flags. Did I miss something?
No, there really aren't. A lot of our human service budgets aren't updated until the actual approvals come through for them, so they are estimates. The only thing that really is a big change is the criminal justice services. That DDAP funding is going away, and the 2 positions for the public defender and the district attorney are still in the fiscal budget. We're hoping to have the departments move those over before the calendar year, so that we're no longer talking about the positions that really aren't working in that area.
They'll just move to the county budget
They'll move to their, the public defender and the district attorney budgets.
and the regular calendar budget.
Yes, yes. So, but they're still in here for now, so we normally don't like to make that change until we know for sure the salary board approves it.
Okay.
Okay, if you don't have anything else, I guess last chance for any questions or comments from anybody?
Good, thank you.
Any staff input? Okay, if not, we'll move on to, thank you. Very well done. We'll let Tammy know that you did her job. Okay.
Not nearly as graceful as Tammy.
We'll go to item 4, which is the other business component. So, do we have additional issues for us today?
I just wanted to bring you all up to speed on something we are seeing on from the treasurer's side of the house. You will see us opening probably more bank accounts currently, and we are working to update the general resolution we did last year. Currently, many of our banking partners and financial partners have more than an abundance of deposits, and so they are really have very little appetite for funding. So we are somewhat challenged, and at the time when we anticipate some larger federal dollars, along with our tax funding increasing, it's just presenting a little bit of a challenge to really disperse money amongst a number of institutions. And the rates we are seeing are very, very low. So,
Visible would be the word.
yeah. So I just am letting you all know this is something we're seeing. You will probably see more documentation around multiple accounts.
Okay. And a lot of this is just driven by all the cash that's out there, so maybe recovery monies and such.
Yeah, banks are sitting on so many deposits that they just, and lending is really not picked up yet, so loans are not.
So it's the Bank Recovery Act.
Yeah, yeah, and so they have so much money, but, and then our deposits, because they have to collateralize them, carry a cost as well, so, when they don't even need deposits, ours are, less attractive, so. Just as an FYI, but I believe we have plenty of sources, and we will be fine. The returns will just be very, very minimal.
Okay.
Thank you.
That's probably, I imagine it might be an evolving situation maybe for some time, so any periodic updates you can give us would be appreciated.
I'd be happy to, and I'm in the process of gathering, the annual reports from our banking partners to again bring them before you to update you as to their, their financial health, and get an approval on the sweeping, like kind of a broad approval on all of the folks with whom we work. So that's in process now.
Fantastic. Thank you for bringing us.
Yeah, no problem.
Anything additional? If not, we'll move on to item 5, which is the segment we always put in here, which is an opportunity for public comment. Any members of the public on the board who are seeking an opportunity to comment or question?
We have one individual, Barbara Pierce.
Barbara Pierce. Okay. Floor is open for public comment, Mrs. Pierce. You need to identify your municipality of residence, please.
She's unmuted. Wondering if she was in the process of being moved over.
We'll give it another few seconds here.
She might not have heard you calling on her.
Yeah, Mrs. Pierce, this is, we're in public comment period now, so if you were interested in making a comment or asking a question, now would be the time to unmute and participate. We'll wait a little bit here for you.
She might be having difficulty because she was unmuted and now she's muted.
Okay.
I asked to unmute.
What's that?
I'm clicking on the ask to unmute. There we go.
Okay.
Okay. I'm just here to learn. I didn't plan to speak.
Okay. Right, fine. We appreciate
Had
it.
some kind of funny rejoining and a spinning ball for some reason.
Okay. All right, well, we're ready to conclude the meeting, so if there's nothing additional from any members of the public, we'll move along. So I'm not seeing any further action toward public comment, so with that, I'll ask for a motion to adjourn. Stand adjourned, thank you.